Thank you all so much for joining us. We're incredibly grateful to have five amazing speakers with us this morning, in addition to Senator Blumenthal. For the reporters on the line, we will start with opening remarks from all of our speakers, and then happy to open it up for a couple of questions at the end. Once we get to that point, please be ready. You can either raise your hand using the Zoom function or put your question in the chat, and we'll do our best to get to everyone. In the meantime, please make sure you're muted, and Senator Blumenthal, we'll turn it over to you.
Thank you so much, Mariah, and I want to join in thanking all of our speakers. We have a group that really represents the greatness of America in all its diversity and its need for healthcare. Let me be very brief because I really want you to hear these stories. We will have a hearing later today. I'm not proud of this hearing. It's called by my Republican colleagues to consider the ACA, and it's entitled Assessing the Damage Done by Obamacare. Assessing the damage done by Obamacare. Let's be very clear. The reason for this hearing is an attempt to decimate and destroy the Affordable Care Act. It is an assault on the Affordable Care Act, nothing less than a blatant, clear attempt to destroy the Affordable Care Act at a moment when Americans are going to the exchanges. Open enrollment has started, and they are making decisions about whether they can afford healthcare insurance. And what they are seeing is premiums spiking. Those premiums are doubling and tripling because Republicans are blocking an agreement to extend the healthcare tax credits or subsidies that are necessary for them to afford insurance. And that's the reason that Republicans have shut down the government. They're unwilling to reach that agreement that we have insisted be part of the stopgap funding bill now before us. But the reason for this hearing is not only to seek to block that extension of the healthcare tax credits that makes insurance affordable for everyday Americans, literally millions of Americans, hundreds of thousands of people in Connecticut. It is an attempt to destroy the entire Affordable Care Act. And it is a betrayal of trust and commitment by Republicans as well as Democrats. But it unfortunately extends an effort by Republicans since the ACA was first passed 15 years ago to repeal it. They've sought a repeal vote countless times, more than 60, in fact, over the history of the ACA. And I just want to focus on one moment in the United States Senate. For me, it is one of the most memorable and moving moments of my time in the United States Senate. It is when John McCain raised his arm and pointed his finger down, and it haunts me. Literally, that McCain moment haunts me because we came within one vote, literally one vote, of losing the ACA. Now, you would think Republicans have learned that the ACA is not only enormously popular, but also tremendously effective in making healthcare insurance available to people who otherwise would have no access to it. And I know it's hard to remember the time before the ACA, but I remember it pretty well because I was Attorney General and I was having to help people during that time when they were denied health insurance because they had what insurance companies called a pre-existing condition, when they were denied health insurance because they were between jobs, when they had no access to health insurance if they were self-employed or they were farmers or entrepreneurs starting out And the impact was not just on them, but on their entire families, on children. We face a turning point that is reflected in this hearing. Will we stay true to the ideals and values that led to passage of the Affordable Care Act? Republicans want to roll back those rights and turn back the clock to a very dark period in our history when people were denied the assurance, the ability to go to bed and put their heads on the pillow at night and know that their families would be covered if there were ever a sickness or illness requiring severe medical care. And we are not going to let that time occur again. We're not going to let the clock be rolled back. There's no question that there are instances of fraud in our healthcare system, as there are in every system, and we ought to try to root them out. There's no question that there are inefficiencies in this system, and that, frankly, healthcare often costs too much, and insurance companies charge premiums that are too high. Nobody has been more critical of insurance companies than I have when I've opposed those premium increases in the state of Connecticut consistently and vehemently. But that's no reason to destroy the Affordable Care Act. We ought to try to lower the cost of healthcare, lower insurance premiums, root out any kind of wrongdoing in any government program, but not literally throw the system out. And so I'm going to stand strong today and every day in favor of extending the tax credits or subsidies that make insurance affordable. Right now, Americans can't afford to get sick on Donald Trump's timetable. They need to know now. They need that assurance that insurance will be affordable. I'm going to stand strong for the Affordable Care Act, despite the myths and misconceptions that you will hear today. The testimony today will be full of myths and misconceptions. We can't allow those myths and misconceptions to dispel or degrade support for the ACA. And I'm hoping my Republican colleagues are going to see through those myths and misconceptions, and the majority continue to support the ACA and abandon this continuing effort to repeal it. Thanks so much, Aaron. That was great. We're going to turn to Amy Raslovich, another cancer survivor, and she too has a really compelling story. Thank you for joining us, Amy.
Absolutely. Thank you. I'm Amy Raslovich, and I'm a breast cancer survivor, but I'm also one of 60% of Americans with at least one chronic health condition. And I apologize for stepping away from Aaron's speech. These were my healthcare bills for stage 0 cancer in the first year. And I actually have another whole bag here too. I'm grateful to be here, but if I'm going to be honest, I'm really angry. I am so tired of Congress treating us like we're stupid and powerless. I'm one of 16% of Americans who's either self-employed or runs a small business or works for one. We're the people that both parties continue to talk about as the backbone of America, the ranchers and the farmers like Aaron, the realtors, the shop owners like Victoria, the dentists, the restaurant owners. Half the people who bought insurance on the marketplace last year fall in that group. And it's actually been a success. What does the marketplace do? It guarantees that insurance that is offered actually covers pre-existing conditions, that it gives us preventive services and screenings that we need for things like cancer, essential health benefits, behavioral health care. It eliminates annual and lifetime benefits and other protections that everybody with employer-based insurance or Medicare or Medicaid are already guaranteed. Now, it's been the success, and the first Trump administration actually made it easier for brokers to help people find the right insurance. And the Biden administration came along and gave more subsidies so more people don't pay premiums. They did this after research found that nobody double dips. you're not getting insurance from an employer and one at the marketplace. Maybe one or two who forgot to cancel. But what it did is it helped younger people and healthier people actually afford insurance before they needed it, which brought premiums down for everybody. Now they want to take these subsidies away, which is going to more than double, and leave on the insurance plans the sick, which is the point of insurance, is to bring everybody in, and they're kicking everybody off. So as far as these younger people, because this is another argument, younger people are less likely, they stay in the marketplace a short time, they're less likely to actually file a claim. So they're not phantoms, they just are healthy, and then they go away. Now, most $0 premiums enrollees are in states like that didn't expand Medicaid, like Texas, like Florida. You take away these subsidies and double and triple people's insurances. As for fraud, because that's the big boogeyman we're going to talk about today, all this fraud, President Biden put in regulations to minimize it, and it made a big difference. President Trump's big, beautiful bill, which, all the things I think about it, one of the things they put in is to stamp out fraud, and it's going to do a good job of doing that. So where is this massive fraud they keep threatening us about? The ACA marketplace isn't a government program. Some states run exchanges to get people on and don't have fraud, like Connecticut. Other states don't regulate, like Florida. They have some fraud. But the insurance companies are private companies. United Healthcare, Aetna, Centene. They're not making money actually on marketplace. So where's the fraud? If you want to go after the fraud, do you then have to go after the private insurance? All of this, the government shutdown that Donna Marie talked about, the attack on the subsidies, is actually about one study that has already been disproven. It's already been shown by health economists that the methods are faulty and the conclusions are invalid. So this isn't a red versus blue. This isn't a D versus R. Both presidents, Biden and Trump, made changes to the marketplace because, as you said, Senator, it's not perfect, but they've made changes so that people, millions of Americans, can get insurance and that these systems become better. So what's the point of this except to steal insurance from small business owners and their employees, from the country's entrepreneurs and their farmers? Who's perpetrating these massive frauds and stealing money? Because we can't do it. Patients make nothing from it. Is it the corporations you're accusing? Is it the brokers? Then go after them. But don't steal our healthcare from us. This is what keeps us alive. It keeps us going to work. It keeps us paying our taxes and our bills, supporting our families. Don't hide behind some made-up problem that doesn't actually exist. Say what you actually mean. If you want to help us, then help us. Listen to health experts. Listen to actual patients and your constituents. If you need to fix something, then fix it. You don't just take it all away and leave people to get sick and die, because that's what you're doing. You don't throw the baby out with the bathwater. Be honest about your intentions. You want tax cuts for corporations, then say that. But don't do it on the backs of our health. Don't do it on the backs of our families and our communities, because that is exactly what you're doing. And then turn around and talk about the small business owners of America and Main Street America and farmers of America, because this is what we need. And you're blatantly taking it away from us. And I'm sorry that I'm angry, but I've been with Donna Marie for how long, girl, that we've been doing this, that we need the ACA to survive. We need the ACA to keep us and our families productive and healthy and together. And taking it away with some BS excuse that doesn't exist is an insult to us. It's an insult to all Americans. So I thank you for the opportunity to vent, I guess.
Thank you. That was great. Thank you so much, Amy. We're going to hear from Alejandro Lopez of San Antonio, and he too has a